Yeah, no, we really didn't, honestly. The one thing that kind of jumped out at me with the response that was given actually is, the health authority keeps mentioning the 1 million visits that they've accomplished since the UPCs were started. And, kind of came to my mind thinking, well, if the health authority is tracking those numbers of visits, why don't they start also tracking the number of people that they're turning away every day and ever since the creation? I feel like that would give us a much better picture of the effectiveness of these UPCCs instead of just a one-sided number. I really appreciate that these people are coming forward to try to hold these forums and do this. I mean, it shows that there's effort being put into it, but we were honestly really quite disappointed with the way that the responses were really scripted and prepared, and they felt like the same answers we've been getting over and over, and we just feel we deserve more than that, and I feel like this is also kind of fueling the opinion that this is, I guess, known as the most secretive government in British Columbia. So I would just love to see a little more transparency from them when we come forward with these questions.
A lot of the doctors that are apparently coming in, and the forum last night mentioned this, the new doctors are saying they don't want the traditional style of practice. They welcome working in a different way and maybe even getting paid in a different way, but they don't seem to be moving towards the urgent primary care centers. Do we know why?
Yeah, it's a really interesting question. And I think I'm honestly just scraping the surface of it right now and talking with some doctors that have had experience, perhaps dabbling into the UPCs and then made the choice to not pursue that, or others that have simply made the choice not to go into that environment. And it does seem like it's a lot of how the facilities are run, how the supports are set up, how the team aspect works. And that's a really big one that I'm hearing, that, we're talking about the government insisting we need team-based care, and we are not denying that. There is a lot of validity to team-based care, but it doesn't seem like the UPCCs are functioning in a team. So why would a doctor want to go there if they don't feel like they're part of the team and they don't feel supported?